right. What's up, everybody? Really excited to be with you today. My name is Jon Gordon. I'm a co-founder of SoundHSA. And we're here to chat with you today about this intersection of sound health and sound money. We spend a lot of money on healthcare every year. You all may not realize, but we spend almost 4 times more annually on healthcare than the current Bitcoin market cap. More than $5 trillion a year on healthcare, 18% of our GDP, $15,000 per person per year. Scary, right? But what's worse is our health outcomes. We're spending all this money, and what is it getting us? We spend 2 to 3 times more than the average advanced country in the world, and we're getting worse outcomes. Lower life expectancy, 88% of Americans metabolically unhealthy, 6 in 10 with a chronic condition. We could go on and on and on about what has happened since we went off the gold standard in 1971. This is a crisis. Our healthcare system is broken. And since 1971, we've seen a huge growth in administrators, 5,000% growth in admin, and only a couple 100% growth in physicians and doctors, the ones actually providing the healthcare. Meanwhile, healthcare price inflation has increased, outpaced general inflation. And we know as Bitcoiners how bad inflation has been since we moved to a fiat standard in 1971. And the problem is magnified in healthcare. And I'd worked for over a decade in the healthcare industry. And finally, in 2020 and 2021, I started studying about Bitcoin and unlearning what I learned in school with fiat economics and the Keynesian economics and understanding what it means to have sound money. And I came to the realization that the healthcare system is broken because the money is broken. You can go very, very deep in different verticals across healthcare. And I've done that throughout my career. But ultimately, that's the underlying message, is we can never fix healthcare if the money is broken. And now who's going to pay for it? The average U.S. couple needs $330,000 saved for healthcare costs in retirement. Crazy. And the Medicare Hospital Insurance Trust Fund is going to run out in 2033. We spend trillions of dollars through the government, through private insurance, and ultimately, one of the biggest issues is that since 1971, the amount of self-pay in healthcare has gone from 70% down to 11%. And what does Bitcoin do? It gives you value to spend. But first, let's enter health savings accounts. Some of you, as we've been having conversations in this room, are already familiar and are already holders of HSAs. But you may not know that the HSA is the only account in the U.S. tax code that is triple tax advantaged. Meaning on the way in, you can get pre-tax contributions from your employer, or you can have tax-deductible contributions by yourself. Tax-free growth. You hear that? No capital gains tax on your Bitcoin held within the HSA. And then tax-free withdrawals. Okay? It's a very flexible tool. It's a very sovereign tool. You can bring it with you beyond your employer. You can continue to expand your horizons beyond that relationship, which has been tied in the U.S. healthcare system since World War II, and health insurance was given as a benefit to employees. And something you may not know is that you can actually spend on healthcare now, stack your receipts, and reimburse yourself into the future at any point. So it's a very flexible tool depending on your situation, your family, and your health. the HSA is a growing and expanding market. There's more than 40 million accounts in the US today, holding over $170 billion in value. More than half of that is melting in fiat. It's not even being invested in the stock market. You think that money is going to be there for you in the future when you need it, and we're all human. We're all going to have health issues come up in our lives, and a point that we are going to need to see a doctor and use the healthcare system.
BitBlockBoom started because we were outsiders and we needed a place that felt like home. Stockyards were always a place for people who didn't fit in. Let's go take a look at the cow town. Put on your hat. Let's go. Stockyards weren't just a cattle town. It was a place for cattlemen, traders, outlaws, and gamblers, people that were building something new. And that sounded familiar. Butch Cassidy and the Sundance Kid were known to spend time here, and Bonnie and Clyde stayed right here in the Stockyard Hotel. Hotels were great, but they're too normal, and Bitcoin is anything but normal. So we moved BitBlockBoom to a place with some edge and some history. They still run Longhorn Steer down this street every day, just like they did 100 years ago. And BitBlockBoom, well, it's just a few steps away. This is Mule Alley. This is where relationships are made. Bars, restaurants, rodeos, hangouts. Mule Alley is the place to come when the BitBlockBoom day is done. BitBlockBoom was built for people who didn't have a home, and the same thing applies to the stockyards. Seems like we finally found a home. See you at the stockyards.
Enter Bitcoin now. Bitcoin is health savings technology, is what we like to say at SoundHSA. What if you could save, earn, and spend Bitcoin all in one health product? And this is where it gets interesting. A family contributing $8,750 a year, which is the max contribution you can make in an HSA over 20 years, with a conservative 25% CAGR, results in $3.75 million a few years from now. And even an individual contributing $4,400 a year, which is your max contribution limit for an HSA in the US over 20 years, at an even more conservative 15% annual CAGR for Bitcoin, it's over $1 million in today's spending power, right? That should be more than enough to cover that number I shared earlier of the $300,000 plus needed in retirement. And we're pumped to introduce SoundHSA, the first dedicated Bitcoin HSA solution dedicated for the modern health sovereign. Now, this is real Bitcoin, and we'll share a little more about where we're heading in our custody solution in just a moment. But this isn't an ETF or a proxy. We've chatted with a lot of you who may be at Fidelity and the ETF and otherwise, and I'll share with you that there's still counterparties in the middle. We're holding real Bitcoin in the HSA. We have an easy user experience. You can transfer accounts, set up a new account. And what's fun is we also have a mobile app that outside of the HSA, you can earn some sats for steps. I'll get into that shortly. And we're showing how easy it is to use Bitcoin. There's a self-custodial Lightning wallet powered by the Breeze SDK in there, and it's also integrated with Nostr. One of the biggest challenges in healthcare and health is as you visit different hospitals and different doctors, what happens to your health records? Nostr could provide that opportunity for you to have your public-private key, just like Bitcoin, for your identity and to communicate with others in a space that is fraught with your data getting hacked and not being able to know even your own body and what's happening and really, truly owning that data. So we're thrilled to announce that in our HSA, we're partnering with the two best in the industry, Gannett Trust and Unchained, who are our sponsors here today, in a multi-institutional multi-sig. Now, I know many of you may already be into collaborative custody or starting to hold your keys or get into this journey. And we're doing something that's first of its kind. We've partnered with Horizon Trust, which is our HSA administrator, based out of New Mexico. Our HSA is already up. It's running. It's live. And they've been a great partner and have several thousand accounts and know what it's like to open up one of these self-directed retirement accounts. What we've done is make that easy. And now with our process here and our partnership with Gannett and Unchained, we make it secure. Right? It's real Bitcoin being held multi-state, multi-institutional custody. So we're really proud of that. And what that could enable down the road for us as we build moving forward is the opportunity to spend Bitcoin out of your HSA. Good luck doing that with your Fidelity Bitcoin. No thanks. Because what does healthcare look like on a Bitcoin standard? We saw the chart of the rising inflation in healthcare. Bitcoin changes that. When you have abundance in money, you have scarcity in health. And when you have scarcity in money, you have abundance in health. And that's what Bitcoin provides. It can provide you time to spend with your loved ones and focus on your health. And the first thing we all focus on, if we aren't healthy, that becomes our attention. I know Gary was chatting with us earlier, and he was telling us that he has this goal of living to 200. I said, that's awesome. You're aging gracefully. Let's keep it going. But how are you going to pay for that? Bitcoin, right? As you age, you have this opportunity now to save Bitcoin for your health in a way that takes advantage of the current situation we have here in the US. And over the last few years, I've been spreading this message across the healthcare industry about Bitcoin, about the power of decentralization. I've seen the centralizing forces in the bigger health systems. No matter where you're coming from here in Fort Worth, you're probably seeing mergers and acquisitions, larger and larger health systems, larger and larger insurance companies. And they're all in cahoots for prices to rise, right? We don't have price transparency in healthcare. There's no free market in healthcare. The patient, the individual, is treated as a pawn instead of an important and powerful sovereign individual. Building on what Brandon said, I thought that was very poignant. And everyone here who's gone through that Bitcoin journey knows how powerful and how transformative of a tool it can be. And for me, that light bulb moment was 6 years ago. I was still working in medical supplies, and COVID hit, and we were getting all of our supplies from China. Well, there's a disruption right there. You start asking the question, what is money? And I started going down the Bitcoin rabbit hole. And after hanging out with some Bitcoiners at the end of 2021 in El Salvador at the first adopting Bitcoin, I said, this is where I want to be. This is who I want to hang out with. This is who I want to build with. Very inspirational. And I also noticed no one's talking about healthcare. It's a huge, huge gap in what we were talking about. And it makes sense. You have financial tools, you have energy markets, but what's the most important energy, right? It's inside. Everyone has this opportunity to find themselves, but also find a provider, find a doctor you can actually trust. Because if you're working in the big health system, you might have 7 minutes on average to spend with your doctor. But in new models of healthcare, doctors I've been working with personally to get onboarded accepting Bitcoin payments. Others that are on board with the mission are doing what's called direct primary care. This is a value for value way of doing healthcare. And now, as of 2026, with the big beautiful bill, you can spend your HSA on direct primary care. So wouldn't that be cool to spend a lightning payment out of your HSA? That's coming in the future for direct primary care. But for now, you can spend that, right? You can spend it today, hold your receipt, and reimburse yourself when you need it. Usually it's $100 a month. It's not that expensive to build this relationship, right? With this doctor provider that can get to know you. And so we're really all about giving that power to the individual, eliminating middlemen, and bringing this free market into healthcare where you can put in that proof of work. Real quick, I'll share something else we're doing that's a lot of fun. Move to Earn. My co-founder Stu is here, had this idea several years ago and said, hey, why aren't we putting Bitcoin in HSAs? Why are there only proxies? And why can't we earn sats for steps? Let's align incentives for people to be healthy. So if you download our app this week, you can earn 7,000 sats for 50,000 steps. And what this does, we see this as a tool. It's empowering personal health education, financial education, whether you're an employer who wants to try to orange pill your people. and give them an extra benefit and get them out of their chair and moving their body. Or you're just an individual who has personal goals, personal health goals that you want to hit. We are building in this space too, because it's not just a financial tool, as I said, and there's dozens of other HSA providers out there. But what we're really passionate about is this connection of sound money and sound health. Because what does Bitcoin do? It inspires long-term sound health behaviors. Anyone who's a Bitcoin around here, raise your hand if you've been to a beefsteak before or shared some steak with another Bitcoiner. A lot of us, right? Nutrient-dense whole foods. 60% of the food in the US is ultra-processed, right? What is the root cause of a lot of these issues? It's the broken money, it's the food, it's your environmental, right? So getting outside, exercising, moving your body, getting sunlight, breathing, right? All of these things can really help you live an aligned and healthy life. These are a couple of pictures from hikes we led last year in Las Vegas as well as in Denver. And what are we doing with Bitcoiners? We're building relationships and we're building community. This is really a full circle moment for me, and I'm really proud to be up here. 4 years ago, I was at BitBlockBoom teaching yoga. And I put out the call because in early 2022, I did a yoga teacher training. And I had the opportunity to dive deep into myself, into my breath. And I saw all of the connections with Bitcoin, the decentralizations, the energy, and ultimately that it's a personal decision to opt into Bitcoin, and it's a personal decision to opt into your health and really think about yourself and tune in to where you're coming from in life. So teaching yoga 4 years ago at BitBlockBoom. This morning we did a run for Hal. Hal Finney was very passionate, unfortunately passed away from ALS in 2014, and continuing to raise funds for ALS research and care. Right? There's a lot of ways to get involved. Get outside and get some sunlight. And ultimately, we believe this connection of sound money and sound health can really be transformative, not only for Bitcoiners in the room, you get it. You understand the power of real Bitcoin savings. But there's a whole other world out there in this healthcare industry that we're also trying to orange pill and share with them this message of Bitcoin. And so I really just want to thank you for your time today. We're out back on this side if you want to have a chat and learn more about what we're doing at SoundHSA. You can learn more. Sign up today. We're here. If you want to check out more, I'm at the Bitcoin Yogi on X and Nostr. And I don't know if you have any questions. Thank you guys so much. Okay.